day, everyone, and welcome to Benita's maternity program antenatal class. Today, Sister Talia will be speaking to us about teething. Welcome, Sister Talia.
Hi, welcome, moms. Yeah, the all scary teething. I've been through it 3 times already myself, so I do know it is quite a challenging thing. And I hope after today, it will just share some light into what we can do and to help our baby, because at the end of the day, all we want to do is comfort our baby and be a relief measure for any discomfort. So tooth eruption, or teething as we call it, it's a means whereby the tooth moves out of position and it goes into the jaws to emerge. And that is what scientists have found, Awa, Zawada, and Batana. And this is over a period of 2.5 years. Teething has often been blamed for a variety of signs and symptoms, and we will be discussing each one. And this is also the early signs of teething. So a lot of babies will show these signs from even 3 months old. Even 2 months, we've heard moms having said the babies have shown some signs. So pain, inflammation or swelling of the gums, general irritability, drooling, disturbed sleep or wakefulness, facial flushing. So we have babies with quite pink cheeks, facial flushing, gum rubbing, biting or sucking. So they take their little fingers and hands and anything they can into their mouth. Bowel upset. So it ranges from constipation or very loose stools or a lot of diarrhea-like stools. Loss of appetite. And it will be an alteration, either not eating enough or just wanting fluid and not really wanting to eat. Ear rubbing, as well. Why this happens is a lot of times is at the same side as the tooth that's erupting, and a lot of moms think baby has an ear infection, which is actually untrue then, because it is the tooth that's coming out that's causing the discomfort. So what can we do? Teething rings, I always say the cheaper the better for moms. You don't need to go and buy the most expensive ones that work. The ones filled with water doesn't really serve much of a purpose because it just moves around. It doesn't give that nice strong jaw to go on the teething ring and to relieve some pain. So you can use your nice clean finger, you wash your hands and you can rub gently on the gums, especially if baby's sitting on your lap. You can use a face cloth. I always say use a soft face cloth that you actually put in some boiled cool water, you rinse off so that it remains sterile. You place it in a packet and you put it in the fridge, not freezer. And as these hot summer days is approaching and baby's really irritable, you give it to baby, it helps with the swelling and the inflammation. And then you make sure you change the bibs regularly. The worst thing babies get is a very bad rash around the chin area, and that's normally as a result of the wetness. The one thing I also tell parents is pacifiers. I know everybody has a different view regarding it, but if you are comfortable and your baby is on pacifiers, it has been shown to actually comfort the baby that's teething, and as they will chew on it for some pain relief. And then medication. So paracetamol, remember moms to follow the dosage on this certain brand, and it's according to the weight of babies and nothing else. It's not according to the age, according to weight. And these rubs such as T-gel or Prodil, we're not brand specific. And you will also see with each baby, everything works differently. So some will prefer one brand to the next, and it just gives them a bit different comfort. And then you don't use it daily. Using T-gels and Prodils and all those things daily can cause a bit of a stomach upset because it's not needed daily. They don't have the same amount of discomfort daily. We try the natural ways, the ones I mentioned from the start, like the teething rings, etc. And then reassurance. This can be one of the most effective methods for this distressed baby that's teething. Just give baby good cuddles through the difficult days and remind yourself this too shall pass.